a couple is having a rough patch in their marriage, they're having issues, whatever it might be, it's not just enough to see pastors. When you go through a rough patch, consider seeing a therapist as well.
That's why, I'm not understanding these days why people are comfortable with sex outside of marriage, right? Because it's on several levels, that connection. And then when it is broken, when that trust is broken, it has a way of harming people in ways that I don't think we have words to describe.
So I'd like to say a very big thank you to you for coming, and I'm really appreciative of it. I just want you to introduce yourself. When I went through your bio, I was actually very intrigued by the fact that you originally started as a zoologist, then you did your master's in business, and now you're a licensed counselor. So can you take us through that journey a little bit?
Thank you for the opportunity.
Yeah.
One of my passions is really to address the stigma associated with mental health and sort of normalize care, mental health care, basically.
Okay.
My childhood shaped me, obviously, but it shaped me in specific ways as to the caring of other people.
Yeah.
I was raised as a firstborn. My middle name is Naide, which means so that you will not fall.
Oh.
So that from childhood, I was shaped or taught to care about how others feel and how they're progressing in life. And so whatever profession I've been in throughout my life, I've found myself always being the one to say, how are you doing? How can we help? Let's explore ways that can help you feel better or do better or feel better about yourself or know yourself better. I studied zoology by accident. My father sent me to the University of Maiduguri to go and study medicine.
Oh, wow.
And as you know, when you go to Nigeria, things are not always as they seem. I got to school and my name was on the list of people to study zoology. Ooh. I called my dad to tell him, he's like, go to the vice chancellor. That's not what he said. So I went to the vice chancellor's office and it was hectic. There's a lot of people. I didn't know who to talk to. So I just left and registered for classes. And so that's how I studied zoology. And my father was like, well, when you graduate, you can progress to medical school. When I graduated during my NYC, I met my husband.
Oh.
And so he wanted to go to Wales to study business.
Oh.
And my dad was like, that's a good idea. You find a master's program in the sciences that you can do. But we already had one child and I really didn't want to stress out myself. I looked for the easiest program and there was a 9-month business program. Oh. I picked that and that's how I studied. That's how I got a master's in business from Cardiff. And then I started to work, started to have children. And one day my husband was working. We needed to make a little more money. And one of my aunts was like, there's this mental health program that you can do for a few hours every night. And so I got in there and I was doing it every week and I really, really loved it. I really loved the working with people with mental health issues. And so I decided to go back to school. That's how I became a mental health professional.
Oh, wow. That's really very interesting. Because I remember the first time I spoke to you, I was trying to distinguish between being a licensed professional counselor and being a psychologist.
I'd just like to say in practice, it depends on what the person chooses to do.
Okay.
In education, a psychologist has a PhD in psychology. And they can practice as counselors if they choose to.
Yeah.
They can also, I know a lot of psychologists who do a lot of assessments and things like that. So the difference is really in the education and the focus of on the education.
Okay. So one other thing is that we're believers, first of all. This is a podcast for believers. And growing up, especially in Nigeria, even now, now that we're in the US and Nigerians in diaspora, generally, there's a kind of stigma when it comes to mental health issues, especially people thinking that, because they're believers, they are not supposed to have mental health issues, or even when they have mental health issues, they don't really want to talk about it. Can you speak to that?
So mental health broadly is really the care of your emotions,
the
care of your thought process, the care of who you are. And the Bible is really big on being conscious of your thoughts, right?
Yeah.
The Bible is whatsoever things are pure, whatsoever things of good report, think on these things. The
Yeah.
scripture encourages us to meditate on the word of God day and night. That's mental health care. That's your health care. That's the care of your mind.
Yeah.
Right. And so the scripture talks about how sin is first of all in the mind and in the practice.
Yeah.
So when you take care of your mind, you're not sinning. At least you're not prone to sin. So the Bible is really big on mental health. I think that it's the way that it's been talked about, it's been spoken about, that has made it skewed towards stigma. So, for example, anxiety, depression, these are mental health issues. Of course, schizophrenia is also a severe mental health issue. Bipolar disorder, so that's a mood disorder, is also a mental health issue. And so when people think about mental health, they're really thinking about psychotic disorders. Meanwhile, everything is care of the mind, right? For example, one place that depression shows up naturally is when there's a death, right? When there's a death, depression or sadness or depressive symptoms, I should say, shows up, right? When the depressive symptoms are over and above what is normal in your culture or in your society or in your community, then it can now be classified as a clinical depression.
Okay.
Right. When anxiety is over above what we consider normal, right? I remember one time I was with my mother-in-law in Lagos, and there was some talk that there was some chaos in the town. And I didn't show any kind of stress, right? I just smiled and said, okay, what time, how are we going to go pick up my son? And she was really upset that I didn't show any kind of stress, right? But I'm not predisposed to show my stress. Like, I'm not naturally that way. And she was really upset. And my mother has long time had that concern for me that, you know, you're not all I remember the day I tried on my wedding dress. I looked in the mirror and said, okay, it's nice, and took it off. And she's like, what? That's it? Right? And so I know our culture is prone to have people want to wear their emotions on their sleeves. And when you don't do that, people can become really, really offended. And so I say all this to say that culture influences how we demonstrate our emotions, so our concerns. And so where in Nigeria, if somebody passes away and you throw yourself on the ground and you're upset and you wear black for a whole year, that's normal. Nobody's gonna question you. But here, if you show up at work with your shaved head, and people are gonna ask, you know, is this too much? Should we send you to should we send you for mental health care and that kind of thing? I say all that to say that culture influences what we classify or what can be considered over and above the norm of how you want to express your emotions and what we classify as a need for external care, as opposed to what is naturally organic around you.
So it's more of culture. But you mentioned something about psychotic. Can you speak to that? What's the, you know, like in a layman's language, what's psychotic disorders, and the difference between that and maybe like the moods and the anxieties? And
I would just like to clarify that it's not all culture. I bring in the cultural aspect because you could show up to your mental health clinician with certain symptoms. This DSM-5, which is how we diagnose people with illness, is very clear on what the criteria one needs to meet to be diagnosed with certain disorders. But it's also clear that you want to be conscious about how people show up with these symptoms, because from culture to culture, they're different. That's the reason why I spoke about culture. But it's clear what criteria one needs to meet to be diagnosed, for example, with clinical depression or generalized anxiety disorder. Psychotic disorders are really when one loses touch with reality. So sometimes people can be so depressed that they start to see things that are not there, or hear things that are not there, or become really paranoid. And psychotic disorders can show up in anywhere from depression to schizophrenia to schizoaffective disorders and things like that.
Okay.
So there's really the loss of touch with reality when somebody starts to speak about things that are not based in reality or behave in such ways that, typically they're experiencing a psychotic break.
Okay, because I've seen quite a number of believers who, especially for emotional reasons, maybe like I've seen people that their husbands cheated or their husbands rejected them, sent them out of the house saying they don't want them anymore. And then they go into this kind of, I don't know how to diagnose this, but it's for you to say. But I've seen people who, they lose touch with reality. And, they sometimes they talk like they're normal. Other times they talk like they're not. You're like, what? Something is wrong. You can't really place your hands on it.
Mm-hmm.
So in that case, like, would that be psychotic, or would that be like the first one you talked about in terms of moods or just anxiety?
Mm-hmm. So it depends on what the symptoms the person is presenting with.
Yeah.
So when they show up in a mental health practitioner's office, they will do some assessments and then diagnose them. But I've always thought that relationships, the break in relationships has significant impact on the way somebody sees life and the way they feel about themselves and the way they feel about the world. And sometimes it can break someone. Oh, we've seen instances where people go on a killing rampage, right?
Yeah.
After that kind of thing, it's a severe, it has severe impact on one's mental health. The break in relationship, and that's why, I'm not understanding these days why people are comfortable with sex outside of marriage, right? Because the impact of a sexual relationship with someone, the Bible says two shall become one, right? It's so it's on several levels, that connection. And then when it is broken, when that trust is broken, it has a way of harming people in ways that I don't think we have words to describe. And so I think that's some of what you're describing when people experience that break in trust. Like they didn't see the world, right? When you're with somebody that you trust completely, you see the world one way. Yeah. And suddenly that is taken from you. And you start to question even the past, not just the future, not just the now. You start to question the past. And it has a way of destabilizing a person in such a way that if they don't have the kind of support that can guide them through, people tend to, break down into like really, really deep depression that can have psychotic symptoms as a part of them.
Okay.
Yeah.
So, but because we're talking as believers right now, I see a lot of shame and shaming, people that have mental health disorders, or people who you just see that they're kind of off one way or the other. And most of them don't get help because they don't want to be stigmatized or labeled as, a family that has, what we call coin, and also, can you please speak to that? Why is that? And what can we do to just, stop the shaming altogether?
When you love someone, right? When you really love your son, your daughter, your sister, your brother, think first of that love. Right? We have a tendency to think, what will people say?
What will people say? That's
right?
it.
What will people are going to say, whatever way you choose. Yeah. So like, put that away and think about this person. How best can I support this person? One of the things I like to talk about is sexual trauma. Right.
Sexual trauma.
Rape, sexual abuse that occurs in families.
Yeah.
Right? Research has shown us that the sexual trauma is terrible.
Yeah.
But the impact of the rejection of family after a person has disclosed to their family that this has happened has even more significant impact on how or if they recover.
Yeah.
So loving your loved one, wherever they present, and looking for ways that they can be supported truly, right, is really how we demonstrate our love for one another. Your neighbor is not going to come and love your child for you, right? You have to get up and love your child. It's the way that you love your child that others are going to pick up and love on that child. If you see a person that goes away and saying, this is my son, introduces them everywhere they go and hype them up, when other people see them in your absence, that's the way they're going to talk to them. Somebody that says, shut up, sit down there. Who asked you to speak? If you're not that, that's how people are going to treat the child. So if you're thinking about what people are going to say, demonstrate that by how you treat your loved one, right? People are going to pick up on that. Again, it goes back to love. The Bible says perfect love casted out fear. Think about your love for this person and let that guide the way that you care for the person as they experience these, whether it's anxiety, depression, right? Follow their lead. Ask them what they need and be there for them. Just because you have not experienced anxiety doesn't mean that it's not real. I have a new client and she was telling me that when people used to say they were anxious, she said, "What's the matter with you? Just get up and go." And she says now that she had a trauma in her life that sort of triggered anxiety. And she said that now she doesn't even know how to explain what she's feeling, but she cannot believe that she thought that what people were experiencing was no big deal. Anxiety is real. Depression is real. We read about them in scriptures. David was so depressed at one point, but he was able to say, "I will pick up myself." He said there's a scripture that talks about David saying something like, "And David encouraged himself in the Lord." I love that scripture because it tells us that he was discouraged. You don't encourage yourself when you're not. He was discouraged. He was down in the dumps. And it's clear he had every reason, from one child raping another to his son trying to kill him, to
those were real issues.
Those were real issues. And if he was not moved by them, he would not be a real compassionate human being. And so it made sense that he was moved by them. But he also did not count himself as insignificant or devalued because he experienced them. Instead, he said, "How can I pick myself up?" Right? And he went to God. We see him going to God again and again. He didn't say, "I've done this great thing, this great terrible thing, and I'm going to go away from God." He ran towards God again and again in his sin and his brokenness. And as he ran towards God, he ran towards his healing. Instead of running away and denying what we're feeling, it's important to run towards healing, run towards God, run towards healing. And God has put people in our lives, right, to help us. Isaiah 50 verse 4, which is the scripture that I base my work on. "The Lord has given me the tongue of the learned, that I should know how to speak a word in season to him that is weary. He wakeneth morning by morning. He waketh my ear to hear as the learned." God has given somebody a word for you, right? He has given somebody a word for you. Do not discount the power of that word to pick you up. I always say that Christians were so privileged. You get to go to church every Sunday and realign yourself, re-anchor yourself, right? You go out all over the place during the week and this bothers you, that bothers you, but you get a few minutes on a Sunday where you can be quiet and hear God's voice and allow that God voice to inform you. And oftentimes he uses our pastors. It might even be the song that the choir is singing, right? It might be just be open to that word. And if that word is not enough for you, seek a mental health practitioner, right? That affirms your faith and allow them to guide you. Right? People have this misconception that therapists or counselors tell you what to do. This is not our job. Our job is to help you figure out what you want and help you get there. We're cheerleaders. We're listeners. We're affirmers, right? We're encouragers. We don't tell people what to do. Obviously, the only cases where we're like directive is when somebody is trying to take their life or trying to take the life of someone else. We have to be directive.
Self-destructive behaviors or
we are directive in those instances. But even then, we help you get to the place where you see the need for help and are able to receive that.
I was also wondering, do you think like people are ignorant of who licensed counselors are? or is still the culture of, shame? I'm speaking from a Christian perspective, like believers, because the way I grew up, like, that sometimes when you don't feel well, you go to the hospital, and people somehow do not expect that you're going to the hospital because you have something to do with your mood, or you're depressed. Somehow it's because you have a disease, or you have an operation, or you have a baby. It's not truly expected that you are going to the hospital to see, or to go and even see a therapist. It's not something we talk about openly within our community. Is it ignorance, or is it still culture, or what exactly is happening?
I think it's a little bit of both.
A little bit of both.
Yes. You had a baby. Why are you sad? You have everything you need. Why are you sad?
Yeah.
Right? Why? Why are you sad? And you start to question yourself. Right?
Yes.
What's the matter with me? I need to pick myself up. Not realizing there's a little more going on, and, some kind of help might be helpful in moving you along. Even here, right, in the Western world, where it has been normalized, there's still stigma associated with it, right?
Oh, wow. I didn't know that.
Yeah. So, there's certain jobs you can't do, or you'll be limited in your ability to do if you have a diagnosis. Even, I remember when I went to counseling school, we had to do an assessment, right? To determine how stable we were, right? And we were told that it's not necessarily that you'll be kicked out of school, but you'll be recommended to get some kind of mental health support, because the work you're doing is going to be stressful, and you need to be prepared for it.
So a licensed practitioner has to be examined to see if they are fit for the job.
So not all schools do that.
Not all schools,
the school that I went to, it was a Christian college, and they required that we attended counseling of our own, both individual and group therapy. So I had to go through group therapy and individual therapy. It was particularly helpful to me because the work we do is confidential.
Yeah.
So you do not disclose the things people tell you, right? And my husband and I are very close, right? We tell each other everything, or as much as we can. And so I remember experiencing some kind of, we call it cognitive dissonance, right? How am I going to do this thing where I don't tell him everything, but tell him everything? And I remember it was one of those times that I thought this would be a good opportunity to bring him into therapy. So he came to therapy with me, right? And as he went through the process with me, he himself saw the value of holding people's confidence, right? So now I don't have to tell him, he can see, because sometimes people's issues are so heavy that I come home with it. And he knows to just say it as well and pray for me and not ask me what they said or what in particular is going on. So I say all that to say, it's a little bit of both. It's our culture, but it's also the community we live in, but it's also our own fears that something will come out. That's another thing, right? So parents, for example, they might see the value of therapy, but they're afraid that some of their child's or their children's issues is as a result of them, or their child might disclose something in therapy about them. And so they don't send their children to therapy because of that. And to that, I just want to say that if you want the best for your child, even if it's going to bring out something in you that you don't want another person to know, it's important to take that risk. And remember, that's why we have licensed professional therapists. They're mandated to keep your confidence, right? That's why, people are afraid of telling people in their community what's going on, for fear it will go around, and that fear is justified. And so this is another instance where, professional therapy is helpful, because these people are mandated to keep
privacy because of the HIPAA laws.
Not just the HIPAA, in therapy in particular, we're not allowed, right, by ethics to disclose what's going on with people. So, for example, you can go out and say, that's my patient, right? If you're a doctor. Doctors do that all the time. But therapists, we can't do that. Unless you decide to tell other people I'm your therapist, I can't go around and say, you're my client, right? It's not something we're allowed to do, right? Just to maintain people's confidentiality.
Okay, so do you think that we need to be more enlightened? We need to learn more about like the church in itself. People need to know more about therapy and the reason why they have to see therapists. It doesn't dampen their faith. It doesn't mean that they don't trust God. Do we need to educate people more, even pastors and the leaders within the church and of course members?
Yes, we do. The bishop recently has been speaking more and more about depression. So in the past, you will hardly hear from people are praying for people with cancer, headaches, they pray for everything, but you will rarely ever hear anybody. But now increasingly, you will hear him praying about depression. That tells me that even him has evolved in his understanding of the things that can harm people. So yes, we need more education, more awareness, really being more open about who is using these services so that other people don't feel alienated because they are reaching out to these services. That's why I say I went to therapy myself. Right? My husband and I had a rough patch that we just wanted some external eyes, right? We sat down, we knew what God said we should do with that situation, right? But we just needed this sort of formalized structure to walk us through it. And we went to this therapist and she was helpful, but she didn't even know what we're working through, right? Just having that organized platform was just really helpful to us. We come back from therapy, we know, okay, this is what we're going to do, right? And, you know, it was really God's hand that led us through that. And it was a really important time in our life, right?
So you think pastors or leaders, people who people respect, are influential when they go through therapy? They might not tell you, they might not have to tell you the details of it, but they should be open and say, okay, I also see a therapist. It's okay to see a therapist. That's what you're saying, right?
Yeah. Can you imagine if Mrs. Oyedepo never told anybody she was sick? She just went abroad and we didn't see her for some time. Like, you know, people that go through, you know, rough illnesses will be like, we have to hide it because people will think we're bad people. Nobody thought she was a bad person, right? It has allowed people to be more open about what they're going through. You hear people all the time, I read her book and I picked myself up. I read the book and because she was able to share her testimony. So you don't need to share the intricate details of what happens. Oftentimes it's not even helpful.
Right? To share the intricate details.
You know, it's enough to say that I went through, you know, really rough patch, like I just said about my husband and I, and, you know, we sought mental health support and we were able to get through it. Some churches will offer great structured pastoral counseling. So you will go, you know, it's week to week, you deal with this, you deal with that, you deal with this, right? And that's helpful, but they're not always trained to help people through, long-term support. Pastors have other things to do, right?
Pastors have other things to do.
Yes. And so it's really, in such instances, it's really important that you seek mental health support, especially if you're trying to change a behavior that seems unshakable, right? Great, pastor prays for you, he sees you, he sets you up on this structure, on this foundation, scriptural foundation. You carry that with you and go through mental health support, right? Week after week, month after month, to address that thing that seems unshakable.
Okay. So what I'm getting from this is that it's not just enough to see pastors. When you go through a rough patch, consider seeing a therapist as well. Well, depending on the situation. For instance, maybe a couple is having a rough patch in their marriage, they're having issues, whatever it might be. Apart from seeing the pastor for the spiritual aspects, the pastor can the pastor be a therapist in the sense of, being able to counsel them the biblical way, but it's short term. But for long term, you have to see like a licensed therapist. Am I mixing it up, or does it make sense?
No, again, everybody's different. So, you know, you have to explore what works for you. So this is why I don't like to see people in church, right? I like to refer them. I would do like a short-term consultation. I would do like 5 sessions, help them find a therapist. You see me in church every day, right? Or every week. right? And sometimes the things that you disclose in confidence, because we're human, you could see me and think about that, and it can affect the way that you're conducting yourself, right? And so this is why it's not really, and then, pastors say it all the time, they're just preaching and God gives them a word to say and you think it's about you, right? Just because you disclose something similar to them. These are some of the reasons why it might not be terribly helpful to stick with the pastor to walk you through certain things. He could start you off, pray for you. If it's something that you really, so some people have like real trauma that takes a while to explore, to work through. I don't know that a pastor, for example, a resident pastor, is set up to walk you through weekly, all the things you need to do to explore and to address and to heal from that trauma.
Okay, so it's advisable that you see a therapist so that you can get professional help. Not just, while it's also good to see the pastor, but for long-term care. I remember when I lost my mom, I went through a very rough patch. It was very, very rough. In fact, I began to question my faith. I began to question a lot of things because we prayed and I really expected, I believed that she was going to be healed. But at that time, I didn't have the level of understanding that maybe it was her time for her to go, because I was just questioning stuff. But I was able to get through that season. After a while, I was able to. But I have someone else who is also a believer and wasn't able to get through that season by herself. She had to get a therapist to get through that season. So that means it's different for different people. So I want you to speak to that, because some people go through trauma, they go through the death of a loved one, and it's very difficult for them to get themselves back on their feet. So what would you advise for people who go through the loss of a loved one?
Yeah, I'd certainly seek mental health support. There are people who I've worked with who come in and think, people in their church say you need to just accept that it's the will of God and move on. I'm even afraid to tell them how I really feel, that, I don't think God did me well, and things like that. And therapy is the kind of place where, especially like a therapeutic environment that has value for your faith.
Value for your faith.
So you want to seek a therapist that aligns with your cultural values. And often when we refer to cultural values, includes religious or your faith, right? And so you want to go to that kind of person that, we know that we don't question God, but it's the same God who says, come, let us reason together.
Yes,
that's the same God who said that, right? And he's not gonna toss you aside because you are questioning your faith. Jesus on the cross of Calvary said, my father, why have you forsaken me? Right? So he's not unrighteous, right, as to cast you away because you're having a moment or a time where you're deeply impacted, right? He gave you those emotions. He understands them. And so being able to have a place, a non-judgmental space where you can walk through those real emotions and come on the other side is really helpful.
Because when I saw her, like I'd seen her when she lost her dad, and I'd seen how it was very difficult for her, but I saw her months after, and she was glowing. She was very comfortable to tell me about the fact that she had seen a therapist and how that she was questioning her faith, she was questioning God, and it was so difficult for her to even go to church. She was having a hard time because she had young children, and at this point she had seen a therapist, and the next time I saw her, she was really gloomy. She could talk to me about it and how the therapist worked her through it and how she understands now, that death is a part of life. And I was just surprised, and I kept that mental note. I'm like, so your life can become increasingly better. You can live a better quality of life, your emotions, the way you approach life, just by being able to talk to someone who is neutral, who is not like a part of your family or like your pastor who would always say, oh, don't worry, it is well. But some other person, like you said, like a third party who is neutral, but also who aligns with your belief, your culture, your faith, and is able to see through your lenses and able to, also give you solutions.
I could not have said it better. Yes. Yes.
Okay.
That's what it is.
Right? All right. There was one myth going for therapy, because you don't ordinarily see a believer say they want to go, or a lot of believers will not say it proudly. So what do you think the myth is that surrounds going to see mental health?
Honestly, that question is difficult for me. I really don't know. But what I do know is that we're living such a fast-paced life that it's very hard for people to stop and ask themselves the question of, what do I need and how do I get it? It's the rat race. You just keep going and going and going, right? And so it's even hard to stop and think, what is stopping me from getting help? Or should I even get help? Right? So I'm not sure that I have an answer for that. I would just say that we're living in such a fast pace that it's really important to stop. And therapy is a great tool in helping you stop and think about the choices that you're making. You don't even have to be anxious. I've worked with people who are getting a promotion.
And they're anxious?
And they're just not sure that they can do the work. And they just come in and we work through it, right? So you don't have to wait until something is earth-shattering. If your job provides you, a lot of jobs have that sort of package where you can, see a therapist for free. Use it. To explore, who am I? Why did I choose this profession? How do I land here? How did I get here? Right? Why do I wear red all the time? All these things have a way of helping you to become increasingly self-aware. And the more self-aware you are, the more likely you are to make healthier, better choices for yourself and the people that you love.
Okay. So I have this question as well. Like, something happened recently. Someone had proposed to his fiance, and after a while they had like a disagreement, and he began to develop cold feet. He broke up the engagement, and right now, they are back together. Does that have anything to do with mental health issue, like cold feet? I know someone who did not also show up on the day of our wedding. She didn't show up. She didn't pick up the calls. She just went somewhere to hide all through the day. And people came from different parts of the world for the wedding. She had everything planned out. But on the day of the wedding, she just disappeared.
Again, I don't know, right? Every situation is different, right? But what I would say is that even this couple that you're saying back together, I would really recommend that they seek therapy. They should really, it's really about exploration, getting to the bottom of why you did that. Why do I have cold feet? What are the things in my past that could have informed this fear of getting married? What are the things I'm seeing that I put under the rug, right? That didn't allow me to make this decision before today. It could be valid with good reason. She might have good reason for, not showing up for the wedding, but, you want to ask, why did it take all this time to come to this place? And therapy is a good place to explore those things. So all these things are unique to people. I cannot give one broad answer. I would say that if you come to a place where you got engaged, you broke up, it will be a good time to stop. And really doesn't mean that the relationship is ended. It really means that you want to make sure that in the future you because you're going to disagree again.
Yeah.
Right? Are you going to keep breaking up? If you're married, it's even worse. Are you going to divorce every time you have a disagreement? It's really important to explore the reasons, and people are often afraid to explore. Right? Maybe they're afraid of judgment of self and of other, if they find out things. But really, if you want to move forward, the foundation of true foundation, right, will ensure that the relationship doesn't break down in the future.
Oh, wow. So, okay, so I would have to tell that person that the person needs to see a therapist. Yeah. Because sometimes it even looks like it's insulting. Like when you tell someone that you might need to see a therapist, some people feel offended because they feel like that means you're saying that I have something wrong.
Like, it might be helpful to talk to someone.
Okay.
Right? Talk to someone.
A neutral person.
It might be helpful to talk to someone.
Okay.
And then say something like, it's really helpful to go to someone who is professional, because that way they're neutral. They don't have a dog in this race, right? And they're trained to support you.
Okay.
And say, put it in that way. Just, if you throw out the word therapist or psychiatrist, right? People just are put off. But when you say, it might be helpful to talk to someone and give an example of someone you do who talked to someone and how it was helpful. There's a reason why we do marriage counseling, premarital counseling, right? It's to help people go through this. But even that, we have a few classes. It's really structured, and it doesn't always give for nuances that people might be experiencing. And so having doing your own work, right? It's work. I always say it's work, but it's good work. It's worth it.
Okay, so that's really good. So another thing I'm thinking right now, maybe the fact that people also think that it's expensive to see a therapist. Is it expensive to see a therapist?
That's a genuine concern.
It's a genuine concern.
Yes. Your medical insurance, if you have it, often covers it, right? But if you don't have insurance, it is expensive.
It's expensive.
But I do know that we spend good money to do our hair, to do our nails,
our makeup.
Our makeup. And so just think about it as an investment
in yourself.
Yes, in yourself. Certainly, that's a better way to put it, right? Think about it as an investment in yourself, a time where you explore yourself. You go on vacation, right, to recenter yourself, right? Think about it as a sort of, pulling away from life to recenter yourself, right, to that place where you want to move forward. It's worth the investment.
It's worth the investment. So, to what we said earlier about the fact that maybe there's a lot of ignorance in the church. I remember the case of someone who had issues. It was still these issues of, man, woman, husband and wife and all. And she began to react very badly, maybe because she was not treated over time professionally. And eventually someone saw it and then called the family and said, why don't you take this lady to the psychiatric hospital? That was back in Nigeria. And when the family summoned up the courage to eventually take her to the psychiatric hospital, they gave her medication and everything. It was like a miracle. But before then, they had taken her to see a pastor. And the pastor said, let's start fasting and prayers. It's spiritual, it's an arrow and all of that. In fact, the pastor was warning them that do not take her to the hospital because this is the case of, a real mental health situation and she's going to disgrace the family. But immediately they took her to the hospital, everything calmed.
Yeah, and I guess this is something I haven't spoken to, right? There's a lot of chemical imbalance associated with mental health issues that can be addressed by medication. So because I'm not a psychiatrist, I don't prescribe medication. That's why I don't like to speak to it more. But there is a role of medication in stabilizing people's mental health, right? There's real chemical imbalance. Depression sometimes is situational, so something happened. Sometimes it's just organic. The chemicals in the brain are just off, right? And having medication that can restabilize the person can turn out to look like this is a miracle.
Okay. So for the licensed practitioners, they are the ones that you speak to. They are for instance, if you think that someone needs medication, you refer them to a psychiatrist.
Yes. I do that often, actually. Right? Yes. When I see some people come in, I don't want medication, I just want talk therapy. Let's go. After a while, when the symptoms seem like they're unshakable, the person even has a hard time doing the things that will help them feel better. Often we recommend, why don't you consider medication management? Just so that you can pull yourself to the place where you can do these things that can help you feel better.
Okay, so I was going to ask about addictions, because you have a lot of people getting addicted to maybe, cigarettes, to the extreme, crack cocaine and things like that, just substance abuse. So does counseling help people who have addictions as well?
Yeah, it helps. We call them co-occurring disorders, right? Yeah. So oftentimes people use substances to self-medicate. Right? A lot of people with trauma will start to drink, start to smoke, start to use other substances to help themselves feel better. People that are depressed, want to take, drink something to sort of calm their thoughts and things like that. Yes, so they will oftentimes will receive treatment to address the addictive behavior, and also receive sort of talk therapy to address if it's the mood that is being the issue, or trauma, or things like that. So I work in an agency where we do both.
Okay.
So you have the ability to have your addiction addressed and your, whether it's trauma or mood concern, addressed.
Okay. All right. So as we round this up, I want to know, like, if someone is there asking, like, I'm a Christian, I'm a believer, I believe in God, and I do everything that the Bible requires of me. I go to church, all the works. Can I have a mental health issue?
I don't know. It's almost like saying, can I have a physical health issue, right? People get headaches whether you're Christian or not, and people get cancer whether you're Christian or not. I think it's similar, right?
Mm-hmm.
We're not precluded from the pain in this world because we're Christian. What we do have, right, is faith, is a savior who has delivered us from it and who has provided deliverance from it.
For us.
And part of that deliverance could be your mental health practitioner. You know, I'm always humbled when my clients say they feel safe when they come to my office. It reinforces that belief that God sent me to do this, right? God needs this person to have a safe place, a place where they feel calm in the chaos of their lives. And so God has put people like me out there for you, and take advantage of it is what I would say. Right?
So take advantage. If you could get, headache, sickness, whatever it is, you could also get, there shouldn't be any more stigma around it. It's just like getting the sickness or whatever, not feeling well and talking to someone over time, talking to your pastor, your friend, so there should be no stigma about it so that you can get the help you need. So I'd like to say thank you very much. Thank you. So is there anything you want to say just to round this up before we go to this question I'd like to ask you from someone?
You don't have to be sick to see a doctor. We go for our well checks.
Yes.
Right? And so I have clients who come to me for well checks.
Well checks.
Right? And so even if you just want an organized way to center the chaos of your life, you're busy, you have children, you have a spouse, you have a job, it's helpful to have somewhere you go once a week or once every other week for a period of time where you're just sort of centering yourself or having somebody guide you through centering yourself. So you don't even have to have anxiety or depression to seek this kind of coaching or support or care.
Okay.
Right.
All right. Thank you very much. So you've heard that. So make sure you get help. And I'm going to put her information there just in case you might need her help. Okay. So I have this question from someone. It says, Dear Teabag series, I'm a Christian. I'm married. I relocated to the US while my husband remained in Africa because of immigration delays. I have become close friends with a married male co-worker who also lives here with me. He suggested that we become friends with benefits, saying God understands and God sees and understands that we are lonely and we actually do not even know what our spouses are doing back home. So what would be your advice to this person?
I always start with, what do you want? What do you want? Do you want to satisfy your cravings, your physical cravings, your emotional cravings, which are valid cravings? Or do you want to please God? You pick. Do you want to stay true to the values? What are your values? You want to stay true to those values? It's really up to you. Again, this is not to invalidate, it's hard. It's hard to be away from a spouse. But figure out what it is you want and figure out a righteous way to do it. If you're away from each other that long and you feel like he's doing something and you don't want to be in a marriage anymore, you can make that choice, right? I don't recommend it, but you can make that choice. There's a clean way to do it. You don't want a messy life. You don't want to be involved with someone here, be married to someone over there, whatever he's doing or not. This is not about what he's doing. This is about what you are doing or what you want or what you feel comfortable with. What do you want, right? And if what you want is to please God, then you don't need me to tell you what to do. Right?
You already have the answer.
You already.
Yes, you're right. Very good. Okay. So I just wanted to ask a few follow-up questions. Like, so how can couples protect their marriages while living apart?
I will first of all say that whatever you can do to not live apart, you want to do it. You want to do it. You want to prioritize your relationship. You want to prioritize your marriage. Nobody's going to do it for you. Your job is not going to make it easy for you to move. Financial pressure is not going to make it easy. But if you trust God, He will make a way.
He will make a way.
He will absolutely make a way. My husband and I had that, thought at one time. I graduated before him, and we were kind of saying, why don't I go home first, and he will join, join me later.
Go home how?
Go back to Nigeria. We went to Wales to study, to do our master's. But I did a shorter program, and he did a longer program. And we're sort of having that conversation, and my father-in-law heard us, and he says, you don't want to do that. He says the phone bill when you're in different states is crazy, right? So that time phone bill was an issue. He says he cannot imagine how we would cope, right? And it's helpful to have people that are around you who affirm you and who can help you make healthy choices. But you want to, whatever you can do to be together, you want to do that first. But if for some reason it's not feasible, then you want to stay connected. Technology, like I was saying, technology was not that easy that time. Technology has made it easier. You want to connect with each other every day. Every day. At the start of the day, if you can, and at the end of the day. You want to stay in each other's lives as much as you can. You want to do videos so you can see each other, because there's a lot that is nonverbal in the way we communicate as couples. And just being on the phone, it's not it. Texting doesn't hold it. So you, as much as possible, you want to stay in touch and stay connected. For example, this person asking this question, if you're connected emotionally, you're less likely to want to talk to someone else who is there for you when you want to talk or have someone around you.
Okay. So I have this last question. Can loneliness ever justify crossing biblical boundaries? Like if you feel lonely and you know that, for instance, maybe you have sexual needs and you know your partner is not there, has not been there for many years, say 5 years, but you're lonely and you feel like, oh, God should understand that you're lonely. In that case.
So healthy solutions are hard work. They are hard work, right? The easy thing would be like, he's not there, I'm going to go. That's the easy thing. But they also come with intense consequences, right? So the hard work would be to address the issue with your spouse. Find therapy. This is not unusual. It's increasingly common to have couples, right, who you think are together and they show up and they haven't had sex in years, right? It's just people, the distance just grows and grows and grows, and you become like strangers, and it's hard to come to a place where you are honest about your needs, right? And so that kind of situation, really, it would be really important to seek professional help. Someone who can facilitate you becoming or feeling safe with one another to the extent that you can have this real conversation about why this is not happening, why this is a significant part of your relationship that has disappeared. Right now, you're not even friends anymore, because friends can have that conversation. So there's an issue. Prayer partners can have that conversation, right? Because when my husband and I are praying, there's certain things that would tumble out of my mouth in prayer that I had forgotten to tell him, right? And we can have that conversation after the prayer. So a lot is missing, and it will be important to at least resolve that before you consider stepping out or having another, or leaving this relationship for another one. Even people that are in the process of divorce go through therapy.
They go through therapy.
Yes, because as hard as marriage is, divorce can be harder.
Mm.
So it's important to prepare oneself for those kinds
So
of
it's safe to say therapy is almost part of your existence because you need it at every phase. I can imagine someone who is even having a baby for the first time as well,
Yeah, and there's some people have real fears
Mm.
about it, about their competency in childcare, and just having someone to talk to, right? Some families are blessed with people in the family that have that kind of predisposition, right? And
Mm.
so, you often see in the family, go talk to that person, go talk to that person. So they have it organically in place. But if you don't have that, especially those of us, right, who have relocated from countries, who are immigrants, are far away from the people that know us, right? It's helpful to
It's
get this kind
helpful.
of support, right? It's helpful.
All right. So thank you very much. It was a very insightful discussion.
I hope so.
Thank you.
Yes.
All right. My name is Juliana. Very happy that you're part of this. And if you have questions, of course, just check the information and send all the questions that you may have. Thank you.
Thank
See you next time.